recording the webinar. So if people, and we're going to be putting it on our website, so if people want to not have their faces shown or anything, there is if you click on the video icon, you can click on that and it will turn off your video. So if you don't mind your video being on, then that's absolutely fine, but please note we are recording it and we will be sending a link to our patients so that they can access it, so that whoever couldn't attend can do. So, you know, if you prefer not for your video to be on, please turn your video off. So just to let you know that it is being recorded. Okay. So welcome everyone. This is a repeat of one of the webinars we did last week, which was very successful, where we had about 60 patients attend for information about the COVID vaccine and the rollout of the program by the government and kind of being delivered locally in our area. So my colleague Kimberley, who some of you will hopefully know and recognise, is our resident expert in the practice, and she's kind of done a very short presentation which will go on for about 30 to 40 minutes. There is quite a few questions that some of you have asked, so she'll try and cover those questions, and towards the end what we'll do is, if during the presentation that you have some more questions, you can either put it in the chat, which is the speech bubble at the top of the bar, where you can put something in the chat, or you can raise your hand as well towards the end, and we'll kind of come to you and you can ask a question, and Kim will be able to answer it. Kim or myself will be able to answer it. Hopefully that kind of explains everything in terms of you know, the process of now. The presentation should go on for approximately 30 to 40 minutes, and then you could ask questions afterwards. Some people at the last webinar couldn't see. Kim shares her screen, and some people couldn't actually see that. At the bottom, when you'll see her screen, you should be able to click onto her icon and where you see the screen, and it should just pop up. So she's sharing her screen now, and if you can't see it, then look along the bottom and you should see her somewhere, and if you click on that, you should be able to do it. But without further ado, I will hand over to Kim, and Kim can hopefully take us through that and then explain some more. Thanks, Kim.
Yeah, great. Thanks, Irene. So I'm Dr. Kimberley Doolan. I know some of you already. Otherwise, hello and welcome. This is the second week that we're doing this talk. So if you came last week, it's going to pretty much be the same. So I don't know if you want to stay, you're very welcome to. As you know, we'll be having some questions at the end. So perhaps it raised some questions last time. We asked on a form for you to send in your questions. We picked out the most common ones, and then I've tried to address them here. I think it's important to start with our why at the moment. So why is it that we're now all panicked and going 100% into getting everyone vaccinated? And this is because of our current statistics in terms of COVID cases. As I know you're all aware, you can't avoid it. It's in the news, it's everywhere. COVID has just exploded in the community since December. Unfortunately, as of Monday, there were 37,000 patients in hospital, and of them, 4,000 were being intubated or in intensive care. This is much bigger than that peak back in April and May when we were first locked down. Unfortunately, we weren't able to control things. So our exit strategy has always been to vaccinate as many people as possible, protect the most vulnerable, and then hopefully remove the pressure that's on the NHS. In terms of the vaccines, all of the vaccines so far that have been approved all focus on what's called the spike protein, this S that we can see on the outer surface of the virus itself. So this is a little diagram of what the coronavirus looks like. The current cause of all of our problems is in this picture. So the spike protein sits on the surface of the virus, and it's what then enters our cells and infects us. What the vaccine companies have done is they've taken this spike protein and they've created the blueprint for how you can produce it, and that's what's then in the vaccine. So the vaccines don't contain the virus, they just contain instructions on how to make this spike protein. So this is an important thing to know in terms of the COVID vaccine itself. You cannot catch COVID from the vaccine. It's not a live vaccine like we use for some other illnesses, and it's not a complete virus even that's introduced into the body. Some people perhaps have the misunderstanding that if you're vaccinated, it means you can't catch COVID at all. That's it, full stop, you're protected. We know that the vaccine does take a bit of time to kick in, and we know that even once the vaccine has kicked in, you unfortunately can still catch COVID, but it's important to know that it means the severity of illness will be greatly reduced. So that might even mean that you don't have any symptoms at all. And because of this, we need to be cautious of those people that have been vaccinated. They'll still need to be socially distancing, following the lockdown rules. And that's because they may not have symptoms, but they may be carrying the virus. And we're not yet sure in terms of our data whether these people can be spreading the virus to other people. The other really important thing that I know a lot of people have been anxious about is with regards to the cell's DNA. So you probably know that DNA is our blueprint for our bodies. It's what makes us us. And when people start talking about genetics and vaccines, people can become a bit frightened that maybe the vaccines will alter our DNA. This is not the case. The vaccine is not able to enter the cell's nucleus, which is where the DNA sits. And also, there's no mechanism by which it can change, alter, or introduce itself into our DNA. So I just wanted to kind of dispel that myth, because understandably, we hear about DNA, RNA, and it sounds like a very foreign concept for a lot of people. So it's safe from a point of view of interfering with DNA. The reason why vaccinating people isn't as straightforward as we would like is mostly to do with the Pfizer vaccine, which until very recently was the one that the vast majority of people were using. Unfortunately, it has to be stored at minus 70 degrees. And this is because the mRNA, which is the genetic material that makes up the vaccine, is a very delicate and fussy structure. So if it gets too warm, it starts to break down and then the vaccine's useless. So we need to be storing these vaccines at minus 70, which needs industrial freezers. We can't just put it in a normal deep freeze. Once it is then taken out of that deep freeze, it can be kept into a normal fridge for up to 5 days, which is how we're able to then, kind of move it around the country. Each vial, so you can see in that picture, that's what the Pfizer vaccine looks like when it arrives. And each of those vials contains the equivalent of 6 doses. And when it arrives, it's this little white powder that you can sort of see in the bottom of that picture. We then have to mix it up with some saline so that we can inject it. And once we do that mixture, once we create the mixture to inject, we have to use that vial within 6 hours. And it's that time pressure really that makes things a bit more complicated in terms of trying to make things as efficient as possible. The AstraZeneca vaccine, which is the Oxford vaccine, thankfully can be stored in a normal fridge. But similarly, once it's opened, we have 6 hours to use it. And each of those vials has 10 doses in it. Although you can get some 8-dose vials. I don't think anyone's team seems to be using those ones. A really common question that comes up is with regards to various allergies or various medical conditions and whether it's safe for that person to have the vaccine. So if you have, for example, a penicillin or a drug allergy, if you have a food allergy, so perhaps you have celiac disease or you react to shellfish, or if you don't want to be consuming any animal products, then it's fine for you to have the vaccines. They don't contain any of these common, food components or medicine components that cause allergies, and they don't contain any animal products. There's no latex used in the manufacture either. The only time that we have to be a bit cautious is with someone that's had an anaphylactic reaction. So that's the kind of allergy where your tongue and your lips will swell up, your airway starts to close, and you'll be needing to go to hospital to have adrenaline. So if someone has a known anaphylactic allergy to an ingredient in the vaccine, then we wouldn't normally give them the Pfizer vaccine. Sometimes we don't know someone's going to have an allergy. So if you have a reaction to the first dose, then again, we might change the dose you have the second time round. The AstraZeneca Oxford vaccine doesn't seem to have many components in it that cause allergy. So if we're ever not sure, you'd normally be given the AstraZeneca vaccine. I'm going to put on the next slide the list of ingredients in the Pfizer vaccine, just in case you happen to know that you've had a serious reaction to an ingredient before in a vaccine. In terms of medical conditions, there's very, very few conditions where you can't have the COVID vaccine. So it's okay to have the vaccine if you're taking blood thinners, so things like warfarin, rivaroxaban, apixaban, clopidogrel, aspirin. These are all fine, but it is helpful if we know about it beforehand so that we can take a few steps to reduce the risk of you getting a bruise from the needle. It's fine to have the COVID vaccine if you're having cancer treatment normally, or if you're on an immunosuppressant treatment. So that's things like steroids, methotrexate, azathioprine, or some biological drugs. And actually, we also think that patients that have a reduced immune system, so perhaps HIV, it's fine for them to have the vaccine too. And actually, our main worry in patients whose immune systems aren't working 100% is that they won't have such a strong reaction to the vaccine. So we're still very keen to vaccinate these people, but we still need to take a lot of precautions afterwards because you may not respond quite as well as the average person. In terms of ingredients, I must have moved that slide around. I'll show it later on for the ingredients. It's a very strange list of ingredients. I'm sure most of them will be very alien to us, and there's only a couple of ingredients that I think would be familiar in terms of causing anaphylactic reactions. The most common question was about how to get an appointment. So at the moment, there's a bit of a two-pronged system in terms of getting patients vaccinated. The government is going through a process to invite people centrally. So in other words, they've got their registers of patients who are over the age of 80, and they're normally posting them letters, inviting them to apply online for an appointment or to book an appointment that way. And they'll normally give you a booking reference code. Please be very careful in terms of text messages that you're receiving to your phone. There's a lot of scams going around, unfortunately. You should never be asked for any payment details. The COVID vaccine is free. Please be conscious if you're clicking on any links of where it's directing you, because you may be sharing some personal information. So generally, this seems to be by letter. So if you get something in the post, then that's generally deemed to be a bit more trustworthy than a random text message. Having said that, as well as the government organising the appointments, we are also able to book locally now. So the nearest hub is actually downstairs in our building, so in the Wembley Centre for Health and Care. We are now able to invite patients over the age of 75 as of yesterday, I think it was. So we've just moved on to our next group, which is brilliant. We will normally text you to invite you, or you may be contacted directly by K&W Healthcare. So that's the company that's been set up to help coordinate for all the GP practices around the area, so we can book into there. We are also vaccinating housebound patients. We've just started this week. Again, we're working through the groups to try to cover as many as we can. Just going back to the government inviting people, we often find those tend to be invites to the larger places, so things like Wembley Stadium just up the road or the Excel Centre. In terms of some patients have asked whether it's worth waiting for one appointment over the other, perhaps if they don't want to travel. It's entirely up to you. My general feeling is if you get an invite, to do your best to get there, because it means obviously you'll get that sooner, and the sooner you get your jab, the sooner you're protected. So if it is possible to go to one perhaps a little bit further away, then I'd encourage you to do that, because it means that at least you're going to get some protection. In terms of when this will happen, we are offering vaccines in a specific order that's been decided by the government. So unfortunately, we can't overrule this. At the moment, it's been those over the age of 80, frontline carers, and we've just moved on to those over the age of 75 as of yesterday. As we work down this list, then we'll start to be inviting more and more people, including those who are on the shielded list. Shortly after, it will be those over 65, and after that, it will be people that have long-term conditions. So this box on the right-hand side of the screen shows the medical and mental health problems where you will be invited a little bit sooner than you would normally, so we can get you protected quicker. It's the million-dollar question in terms of when you'll get your vaccine. There is a website called the Omni Calculator, which if you're techie, you can go to. You can put in your age, a couple of questions about whether you have some medical problems, and it will then estimate when your vaccine is most likely to be given. And that's based on the current rates of how quickly we've been able to vaccinate people. So it's very difficult for us to tell you here exactly when it will be. This website can offer you an approximate idea. So, for example, at the moment, if you're aged over 65 and you have a medical problem such as blood pressure or diabetes, we're looking at around the middle of February to give you a rough idea, because that's one that I happened to have looked up the other day. But yeah, please have a look at this website. It's obviously just an approximation. It's just giving it an estimate of when the time may be. But if you're keen to kind of prepare yourself psychologically, this is the best gauge that we have at the moment. As I was mentioning on the slides before, this is the list of ingredients that's in the Pfizer vaccine. So if you know that you have an anaphylactic allergy, so a very severe allergy to any of these ingredients, we'd recommend that you don't have the Pfizer vaccine. Some of those ingredients, things like cholesterol and sucrose, are in your body naturally, so it'll be extremely unlikely that you have an allergy to those. It's more likely going to be those first couple of very long named components that may cause a problem. If on the day you're not sure, please just ask when you arrive at the vaccine centre. A couple of other questions that have come up. So a few people have unfortunately had COVID already, and they've asked about whether they still need the vaccine. At the moment, the advice is yes, you should still have the vaccine. We currently aren't quite sure how long the natural immunity lasts for COVID. We think it's probably at least 6 months, but it does seem to be quite variable. I think most of us have all met patients now that seem to have had COVID more than once. So, it just suggests that perhaps immunity isn't as good as we would like it to be. So that's why they recommend that you still have the COVID vaccine. It will give your immune system that little bit boost, so get your antibody levels up nice and high to protect you in a stronger response. We do recommend, however, delaying the COVID vaccine for 4 weeks after you've had your COVID symptoms. Or if you didn't have any symptoms and it was picked up just randomly on a test, then it's 4 weeks from that positive test that you can have the vaccine. At the moment, the technologies that are used for the vaccines seem to suggest that protection should last at least a year after having the vaccine. And it seems to be a stronger response to that we see naturally as well. So again, just evidence for why having the vaccine is a good idea, even if you've had COVID. Some patients were asking if they would have a choice of vaccine between the Pfizer and AstraZeneca. Unfortunately, at the moment, that is our biggest limiting step, is getting a supply of vaccine. So a lot of the manpower and the logistics is in place in terms of getting the vaccines into people, but unfortunately, we're often waiting on the shipments to arrive from Pfizer and AstraZeneca. So because of that, it means it's not really possible at the moment to give patients a choice in terms of whether they're having Pfizer or AstraZeneca. And come the spring, we'll also hopefully be having the Moderna vaccine as well, which is the one that's the biggest one in the USA at the moment. That's due to arrive in the spring, so that will hopefully be coming out soon. In terms of safety of vaccines, understandably, with any new vaccine, people are going to have worries. I think it's important to differentiate safety concerns from side effects. So I'll talk about side effects in a second. In terms of safety, any new medicines or vaccines in the UK have to go through a very vigorous process of being checked by something called the MHRA. So that's the body that decides whether a vaccine or a medicine is safe. They will look at all the trial information, all the risk of side effects, any adverse events during the trials, and they then look at that data and decide whether they think it's safe enough to give them to the population. So this is the normal process that the MHRA has gone through. That hasn't been rushed, that hasn't been altered for this vaccine. It's the exact same testing that they normally would do. The trials, in terms of the most recent COVID vaccine trials, were started in the beginning of the summer. So they've been going on for a good sort of 7-8 months in most cases now. And before that, they were done in smaller numbers of people and on animals and cells. So it's gone through a step-by-step process to assess its safety before those big trials that you probably would have heard of that started at the beginning of the summer. The reason that this vaccine seems to have been rushed through and appear very quickly is because of the fact that, for once, the first time ever, the whole world has worked together with this sole aim of trying to bring out a vaccine. So you had thousands of labs and hundreds of companies all trying their best to try and create a vaccine that would be safe and practical. And because of that, the vaccine has appeared in pretty much, less than a year, which is an amazing feat of science. The other really helpful thing was we had a lot of people volunteering to be in trials. So quite often when we're running trials for vaccines and medicines, it's the recruiting patients, recruiting volunteers that's the slow point. This time around, thankfully, so many people volunteered that they could run the studies much more quickly than normal. And the other thing that happened is because this was being done in several different countries, they could run trials simultaneously in different places rather than doing the normal routine of going one, then the next step, then the next step. Instead, we had some bits happening in Brazil, some bits happening in America, some in the UK, and it meant that that data could be collected a lot more quickly than usual. Any new medicine or vaccine is monitored, and that's monitored independently, which means that these drug companies aren't involved in collecting that information. The monitoring is done via something called the yellow card scheme, which has been in place in the UK for many years. So anyone that has any side effects can report their side effects using the yellow card scheme, especially if it's something that might seem a bit unusual. In terms of longer term safety, we would normally expect that by now we'd be starting to see problems if there was anything serious. It's quite reassuring to know that about 75 million vaccines have been given worldwide now, and we're not really seeing huge reports of any problems. Even in the UK alone, we've managed to vaccinate over 7 million people now, which is over 10% of the population, which is a fantastic number. It makes me very proud. You may have heard about some deaths in nursing home residents in Norway. So this was in the news about 2 weeks ago. There were some patients in care homes and nursing homes who were having their vaccines, and they noticed shortly afterwards that a few of them had unfortunately passed away. The Norwegian health authorities looked into this. They didn't think that there was a link, and when they looked back at the data, the rate of deaths was actually lower than they would expect in this age group. So I think it's quite reassuring that that's unlikely going to be a significant link. But as I mentioned, any new medicine is very closely followed up. And I feel like if there'd been anything significant, we'd be starting to see that evidence as of a few weeks ago, really. I then compare that safety to the side effects. So, safety wise, it seems generally a safe vaccine. However, when it comes to side effects, we have noticed that quite a lot of patients do get side effects from the vaccines. So, the really common ones are to have a sore arm, and that's with both of them. It's quite common, so more than half normally will get some sort of chills or feverish feeling. It's very common to have some muscle aches after the vaccines as well and feel tired. Mute this person. Okay. So very common to have some fatigue, so some tiredness afterwards, and headaches are also quite common. So side effects, unfortunately, do seem to come along with the vaccine. The studies show that as we get older, the side effects seem to be less, which is nice to know. Most of these side effects will just last a couple of days. It's very unusual for them to last more than a week. If you do have your vaccine and you get any of these afterwards, it's totally fine to have some paracetamol if you want to for some pain control and to help with your fever or your other aching. The paracetamol won't stop the vaccine from working. In terms of effectiveness, so we've talked there about the safety, the side effects, but how good are these vaccines at doing what we want it to do, which is prevent people from becoming seriously unwell with COVID? So when we look at the Pfizer studies, after the 2 vaccines, so that's the full course, there was a 95% efficacy rate. So what that means is basically shown this very beautiful graph on the left-hand side. On the graph, if you look at the axis which is going upwards, that's the number of COVID cases. So that's based on symptoms or on swab results. And going across the bottom, then we're looking at day by day. The red line shows all the volunteers that were not given a vaccine. So they were injected with a fake vaccine. In other words, it's normally saline. And this blue line then shows those which were given the Pfizer vaccine. And what we can see is that from about day 7 to 10, there's a split between these groups, and a very dramatic difference then emerges between the number of cases in the non-vaccinated group, that's the red line, versus those that were vaccinating. This is an absolutely amazing graph to see as a doctor. This shows how effective these vaccines are, the huge reduction in case number and serious disease as well between those two groups. It was a really nice graph to see. In terms of effectiveness, there's a bit of controversy around how good 1 dose is versus 2 doses. And I'll talk about the different numbers that are being thrown around in a second. But in the UK, there's the Joint Committee on, I think it's Vaccines and Immunisations, JCVI. They have looked at the data from the studies and they've calculated how effective they are after 1 vaccine. And they have decided that looking at the data, the Pfizer vaccine is 89% effective and the AstraZeneca is 73% effective. So that's very good rate. So even the lower one for AstraZeneca is much higher than our usual flu vaccine. So on an average year, the flu vaccine is about 60% effective. So they're already a deal higher than our annual flu jab. Currently, based on this evidence, you'll be offered your second dose between 10 and 12 weeks. Currently, it's generally 12 weeks after your first dose. And obviously, that's as of today, which is the 27th of January. The government may well change their mind again, but for now, it's 12 weeks between the 2 doses. We do try to keep it to the same brand, so the same vaccine both times. In some circumstances, they may need to give you the other one. For example, if you had a severe allergy first time round, you may need to switch to AstraZeneca. But generally, we will try to keep it to the same vaccine. The switching in between vaccines shouldn't really be a huge problem because they're both really doing the same job. They're both coding for that spike protein on the virus that I mentioned at the beginning. So it doesn't hugely matter between the which brand you get, but obviously it'd be nicer if we stuck to the same one. In terms of the numbers which are being thrown around, you'll find that there's quite a big difference between what the JCVI say in terms of effectiveness after 1 dose and what Pfizer, the drug company, is saying after 1 dose. So Pfizer have said that after 1 dose, it's 52% effective. And the JCVI, the UK board, have said that it's 89% effective. And I want to explain this huge discrepancy between numbers. So what Pfizer have done is what's inside this pink box. So this big pink box, which is covering from day 0 up to day 21, they've looked at all those people that have had the vaccine and seen how many people seem to be getting COVID. What we need to remember here, though, is that after about day 3, these two groups start to split. So the blue group are those that have had the vaccine, and the red group are those that had a fake vaccine, a placebo. We can see that day by day, these start to split more and more until they're very different around day 12. You can see they're on a different trajectory. So if we think about the fact that a vaccine probably takes about 2 weeks to kick in, anyone that's had COVID within the first sort of 12, 14 days hasn't had any protection from the vaccine. This has just been poor luck. They happen to have caught COVID before that vaccine had a chance to really stimulate the immune system. And so if we then ignore that first group, so if we ignore those first 2 weeks when the vaccine is still kicking in, and we only pay attention to day 15 to day 21, which is what's in this this yellow box, this then shows us that actually once the vaccine's kicked in, it's about 89% effective. And that's what's given us these two very different numbers between 52 and 89%. The 52 one is when you take into consideration before the vaccines had a chance to kick in. But if we then take the probably more sensible approach of giving that vaccine a bit of a chance to work, then we're looking more at about 89% effectiveness. So hopefully that's helped to clarify, because I know it's been very confusing having these two different numbers floating around in the news. Another very common question is people are still having their flu jabs and other jabs as well, and whether they need to be waiting between having their flu jab and their COVID jab. We prefer if there is a week in between the injections. It doesn't matter what order, but we like there to be a week if possible. However, sometimes we might make exceptions to the rule. For example, if someone's very frail and has made their way to the vaccine centre, it might be that they'll give both. It's not thought to be because of any significant issues. It's just more a case of if anyone gets side effects, it can be quite difficult to pick apart what's being caused by what when you've got this overlap. Another really common question that has come up is about what life is like after having the vaccine. So, unfortunately, for now, nothing will change. So, even once you've had your second dose and we consider you protected, you will still need to follow the government lockdown rules. You'll still need to be socially distancing, wearing masks, staying at home when you can, because these vaccines are only one part in our fight against COVID. There still needs to be public health measures and also improved treatments for us to really tackle COVID full on. Um, our other worries, really, in terms of why we still need to be very careful, is because we're not sure about spreading the virus. So there was a paper that came out in a very well-respected journal called Nature. I think it was around about September time, that did suggest that patients that have COVID but don't really have symptoms are generally not that contagious. So, in other words, they're not generally people that spread a lot of virus around. So we would like to think that if we can extrapolate from that, that if you have the vaccine and your symptoms are very mild, or maybe you have no symptoms at all if you do catch COVID, then we would hope that you're not someone that then will be able to spread the virus. But unfortunately, we don't know yet. We don't have that data. That wasn't something that we were looking at in those early trials. The trials were just aiming to look at reducing severe disease and taking the pressure off our intensive care and hospitals. So for now, we still need to be cautious because we're not sure if even if you're protected, whether you can still carry the virus and give it to other vulnerable people. We also know that the NHS is currently completely overwhelmed, and we need to really have much better control of things before we can start to relax in terms of lockdown rules. And in an ideal world, we'd use what's called herd immunity. So, herd immunity is when you have a proportion of the population protected a bit against a disease, but normally by a vaccine, because it then reduces just the amount that's just generally in the community. So, we would ideally like for a significant portion of the population to be vaccinated, but that's going to take some time. So I think what will happen is as the vaccine injection rates go up, and hopefully as our COVID rates in the hospital start to come down, I think gradually the government will little by little start to relax things, as we can then, hope that our more vulnerable are protected. So unfortunately, it's not a matter of having the vaccine the next day. That's it. You can go back to normal life. Unfortunately, it's still going to be a bit of time before we're looking at returning to a more normal life. Another thing that's in the news quite a lot is about the different strains that are going around. So it's very normal for a virus to mutate. So, in other words, for a virus to change. And that's because when it copies itself to create copies and spread the virus around, it's not always very accurate at copying itself. So it's a little bit like if I asked you to write out uh, I don't know, a dictionary 20 times, you're going to have some mistakes in there. No one's going to be able to write the same thing again and again and it'd be perfect. And the same thing happens with the virus. When it's copying again and again, it starts gathering errors as it goes. At the moment, the common strain in the UK, which is also spreading around the world, and we've also got the South African strain as well, which is becoming more prevalent around the world. At the moment, the vaccine seems to be giving protection against these. So it's not the spike protein, that's the part that we're vaccinating with, that is mutating, thankfully, at the moment. But we will obviously need to keep an eye on things. So thankfully, for now, the vaccines seem to be offering protection against these different strains. In terms of boosters, then, so as you know, when it comes to things like the flu, every year they bring out a new flu jet vaccine to compensate for these changes that happens in the viruses. At the moment, we don't think we'll be needing to give any booster doses, but we will need to keep an eye on things in terms of these mutations to see if any new vaccines will need to be brought out. And I think it'll become a little bit like the flu vaccine every year. It might be that we end up having a flu vaccine in one arm and a COVID vaccine in the other at some point as it changes gradually. In terms of protection, we think that it probably is going to be protecting you for over a year, but that's on our best scientific guess. So that's on our best guess looking at the technology that we're using. So hopefully it gives us a fairly long coverage, but as the virus mutates, it might be that we still need to have some booster doses. In terms of COVID vaccine, just information in general, I have put a page up on our website. So the link is here. You can find it in the self-help section if you wanted to find it that way. It's updated regularly, so I've updated it this morning even. Again, covering common questions. I also cover a little bit about breastfeeding and pregnancy in there, because although it hasn't come up with questions that have been sent in to us, I know it's on a lot of people's minds. So please do head to our website to check out the information on the COVID vaccine. As Dr. Natani said at the beginning, we have also got some webinars coming up. So you can find these now. We'll be putting them up on our website. So as we mentioned at the beginning, our session today is being recorded. So please turn your camera off if you don't want to appear on the video. So we'll be uploading it then to our website shortly. And you'll also be able to find upcoming webinars on our website here. So Dr. Natali is doing one on Friday about signs of heart attacks, which I think will be very useful. So please check here regularly. We'll try and put them up on the website. We've got some other plans in terms of common requests, so diabetes, blood pressure, mental health. We've got lots of topics that we're planning on covering in the coming months. Something else that I think is worth mentioning, so if you're not registered with us as a patient, you can do this online. It's a very quick, easy process. It's just a form online that gets sent to us. We just need to know a little bit about you and your medical conditions, and then you'll be registered with us. So we like to think it's a very easy, streamlined process. It's very easy to find on our website. This is our homepage. So if you would like to register with us, then please do. We would love to welcome you to Primary Medical Centre. And that is the end of my slides for now. So normally now we would go to questions. So let me stop sharing my screen so I can start looking at some questions.
Excellent. Kim, thank you very much. I think that was hopefully very useful. I certainly learned more than I did last week, so you've clearly done some extra work, so thank you. There are a few questions that have come through, so what I'll do is I'll kind of go through them from the top, if that's okay.
Yeah.
There's a question that's a patient has said, I'm a type 2 diabetic and over the age of 66. So will I be in the special group? My husband is 64 plus and is a diabetic on insulin and also a heart patient, and how will he be treated?
So someone's talking, let's just mute them. Okay, I think they're muted. So the first part of the question, so age 66 and type 2 diabetic, we actually, for you, can ignore the diabetic part because 65 and above is coming shortly. However, then interestingly for your husband, because he's 64, he would be then coming in the group after you. So to be honest with you, I suspect at that point there'll probably be a bit of overlap and you'll probably end up getting your vaccines around the same sort of time. There is a big push at the moment to try and get people vaccinated. So I'd like to think that you both would have your vaccines by March, but it entirely depends on this supply. So that's, like I mentioned, that's our main problem, is in terms of supply of the vaccine.
Yeah. Kim, one question, perhaps what we might be able to do is, I don't know if you've already done it, but the link that you have for the vaccine kind of timeline, is that on our website?
No, I'll put that on there.
So I think that's a really good thing.
So yeah, if anyone has any specific questions about when they want to know when their vaccine will happen, I mentioned that website earlier, and I'll put it on our own website, the link, where it's basically an approximate calculator. So it's really hard for us to tell you the date because we don't know what the supply is like. It's very unpredictable, unfortunately. There's even been cases where clinics have had to be cancelled last minute because we just can't get the vaccine. So, we're doing our best. Everything's in place. It's just a matter of the supply, but I will link this this calculator onto our website so you can get an idea of when your vaccine is likely to be.
And I think probably a good thing to perhaps touch on is who is doing it versus us, because obviously we're not currently vaccinating, and maybe that might change. And we've had perhaps some tentative news that we might be able to start giving the vaccine in the next few weeks at our practice. So if that's the case, then obviously things will change and we'll communicate with you. But at the moment, it's not being given by us, so it's very difficult for us to kind of predict some of these things.
Yeah, in fact, it was only this week that we were finally allowed some vials to go and start doing our housebound patients. So, in terms of us getting to vaccinate, it's still very early days, and mostly it's being organised downstairs and centrally by the government at the moment. And
Yeah.
that's purely because, when they're thinking about the logistics of moving this vaccine around at -70, they want to put it at the centres where there's a huge number of people. So, when it comes to us, then in comparison, we unfortunately are having to wait for AstraZeneca, which we can store. So, we're very keen to give it. And from our very successful flu vaccine drives, we know that we can be really well set up to do it. So as soon as we get that green light, we will be setting up our clinics, and hopefully then the numbers will really go up.
Yeah, fantastic. Kim, so if anyone else has any questions, please either put them on the chat or you can raise your hand and we can ask you kind of towards the end. There's a couple of questions which are kind of similar. One was, I suffer with asthma, when do you think my turn will come? And also, again, kind of similar to this is, so will they only go by age and medical conditions won't be considered?
It's a mixture. So if you are over 65, it doesn't matter whether you have other medical conditions. Once they get to your group of over 65, you'll be in that group. It's only if you're under 65 that they then start to consider medical conditions in terms of you being a priority. So if you're under 65, then your medical conditions do matter. If you're over 65, your medical conditions don't matter at all. You'll get called with the rest of your age group.
Yeah, fantastic. Great, thank you. There was a question again about, I'll read it out. So when I inquired about the home visit for my 97-year-old mother, I was told PMC are not getting the vaccines till March, April. As a result, I took my mum to the Fulton Road Mass Vaccination Centre with great difficulty. She has a second vaccination on the 9th of April. Can this be done at home, please?
That's, I think maybe Irene, you might know the answer better than I do. It depends a little bit on which vaccine she's been given, because at the moment we can only get access to AstraZeneca, and we're not hugely keen on mixing them. So I know that when it comes to our home visits, I'm not sure whether you know if we're getting any more doses, Arun.
So I can probably answer that. So we found out, and again, the communication from the government to us has not been ideal always. So from our perspective, we're getting kind of information put down at the very last minute. So on Thursday night, we were told that we can have vaccines to go and visit our housebound patients. Prior to Thursday, we had no idea when that would happen. And part of that is because the Pfizer vaccine, as Kim has already mentioned, is unstable if you move it. So the AstraZeneca vaccine was approved after the Pfizer vaccine, and actually there was a supply issue that was preventing some of that problems. And even now you'll hear in the news about the supply issues that are happening. So what we found out that we were going to get them on Monday, and we were getting them kind of just prior to the weekend. So we planned it all. So I went out and vaccinated 23 people on Monday just for our housebound patients. So unfortunately, there was the problem is much more around kind of supply versus the demand of who wants to have it. And once we can have it, then we can do it much more. It's likely that your 97-year-old mother probably had the Pfizer vaccine, depending on where it was. You should have a card that says where it was, but it's likely to be the Pfizer vaccine. And if that's the case, the ideal thing is to have the second Pfizer vaccine. So, unfortunately, the speed of what's been given to us has been very, very delayed. And all we can do is apologise. It's not really in our control, unfortunately. So hopefully that answers your question. There is a question. I have a clot in my heart. Would it be okay to take the vaccine?
Yeah, that's not a contraindication I know of. I suspect you're on a blood thinner for that. And again, we know that it's fine to have the vaccine if you're on a blood thinner. If you're on the blood thinner called warfarin, it is helpful if your blood test, your INR, is in the correct range. But that's purely just because of the fact that we're putting a needle in your arm and we don't want you to get a huge bruise. So even if your INR was out of range, we still would often give the vaccine, but we just would put a bit of pressure on afterwards to stop you from getting such a big bruise. But yeah, in terms of the clot in the heart, that's not a reason to not have the vaccine.
Yeah, perfect. Thank you, Kim. That was a really good explanation. We've got another question. Are unpaid carers of severe mentally disabled being prioritised? Also, are mentally challenged people being prioritised?
Yeah, so yes to both. So for unpaid carers, they're currently being put in group 6, which is the equivalent of people that have long-term medical conditions. My understanding, and maybe Dr. Natani, you can correct me if I'm wrong here, is that it's quite helpful for us to know that you're a carer because we can code it in your medical notes, which means that then when it comes time for us to search for these things, you'll be flagged up. So if you are a carer for a relative, then please let your GP know so they can code you appropriately. And then it means that once we get to that stage, you'll be invited for vaccines. In terms of mental health problems or learning disabilities, it's all in the list. It will be a similar time. It'll be group 6 that we start bringing those patients in. So really difficult to guess exactly when that would be, but that's probably going to be sort of, I would like to think, middle, end of March.
And perhaps if that the person who sent the comment, if they are registered with us, if you drop us an email, you can do that via our contact us on the website, and that'll give you the email address, or you may already have it. If you just drop us an email just to make sure that you are a carer and you are already coded as a carer in our system, then we can make sure that that happens, to make sure that you are prioritised in the way that Kim's just mentioned. Will the clinically vulnerable get the vaccine is another question.
Yeah, that will be soon. So at the moment, let me just explain the groups again. It was in one of the slides, but at the moment we're doing group 1 and group 2. So group 1 is those over the age of 80 and frontline health workers. So that's kind of doctors and nurses, care home workers. Group 2 is over 75. So we've just, as of yesterday, been given the green light to start inviting people over the age of 75. Once we get to, I think it's around 80% coverage, we're then allowed to invite the next group. So we get told when we're allowed to invite group by group as we hit certain targets. The next group will be those over 70, and the next group after those are the people that are shielding, so there's clinically vulnerable. So you are next but one in the queue at the moment. The government, I think, originally was hoping for mid-February we'd be getting to that stage. I mean, fingers crossed. It's really difficult to know exactly. It's unfortunately not an exact science in terms of the supply, but certainly you're coming up soon.
Fantastic. Great. Does anyone else have any questions? You can either raise your hand or put it in the chat. It's not a problem. Just whilst anyone might be typing or things, I think one of the things that I just wanted to hopefully communicate to all our patients and the people that are listening is, hopefully what we're trying to do is send out kind of some of these things in terms of education to empower you guys to make the right decisions about your health and your own well-being. And one of the things is, from our perspective, if you know, we're trying to record these webinars so that you can share it with your friends and family, because we know not everyone can always attend at the time. And if you feel it's going to be useful, either this one or some of the other webinars we're doing, please share them, because at the end of the day, if we can get people to make the right decisions about their own health, that's what we want. In terms of the COVID vaccine, probably just to reiterate, I think our whole practice has had the vaccine, if I'm not mistaken. So I think my parents have had it. My parents, who most of you will know as kind of the more senior GPs in the practice, and everyone else in our practice has had it. So we would highly encourage everyone to get the vaccine if they can. Kim, I think you'd probably reiterate that, wouldn't you?
Yeah, absolutely. I mean, it's important to know that the government aren't forcing anyone to have the vaccine. It's completely optional. We all have our own ideas of levels of risk and what we're comfortable with. For me, I was very keen, as Irene will know, I was desperate for the vaccine. I was very keen to get it. I think we have a little bit of almost like an insider feel for how serious COVID can be. We've had, unfortunately, some patients that have passed away from COVID. We're also seeing quite a few patients that have long COVID. So that means that even once they've recovered from that initial illness, some people are really quite unwell for a long time afterwards. And because it's a new disease, we don't know if this long COVID is a matter of a couple of months of illness, or if this is something that now might be impacting them for life. So sadly, I think we all know patients that were young and fit, even people that have been running marathons, for example, who now are struggling to get up the stairs because they're so breathless. So I think we maybe have an eagle's eye view of COVID and how serious it can be. So for us, I think it was quite an easy choice for us to have the vaccine. But I understand that some people will be a bit reluctant because, in fairness, it's a new vaccine. We don't have a huge length of data, so I can understand why people had concerns. It's all about balancing that risk and that benefit for you as an individual, and you have to make your own decision.
Yeah, fantastic. Thank you. There's one last question that I can see, which is when will we get notified by our GP when our turn comes for the vaccine?
Yeah, so at the moment, like I mentioned at the beginning, there's sort of like a two-prong attack. So the government's contacting some people by letter directly, and then we are also being told when we can invite people. So you may even end up with 2 invites at a similar time. We're contacting patients. Sometimes you might get a message from K&W Healthcare, which is the organisation that's been set up to deliver for us and all the other GP practices in the area. So if you get any messages from K&W Healthcare, that's for your COVID vaccine. If you get a message from us, again, we might be inviting you for the vaccine. And as things change and perhaps we start to get access, we hopefully will be setting up our own clinics, just like we would with the flu vaccines as well. But yes, you will be contacted. We're running the searches regularly, seeing who's been vaccinated, seeing who hasn't been vaccinated, and trying then to pick up people.
Excellent.
Sorry, can I just tag on to that? It's really helpful if we do have an up-to-date mobile number for you. So please, if you have an old mobile number that you think we have on our system, please email us with your updated one. It's so helpful if we could contact you, especially because we're trying to do a lot of things by text now, because as you can imagine, doing our normal GP work and trying to vaccinate the majority of our patients is a big use of manpower. So we're trying to do a lot of things by text where we can and automate it. So please make sure a mobile number is up to date if possible.
Fantastic. I think that was the last question. So I think just from my perspective, thank you so much for attending. Hopefully you found it useful and informative. And we'll be sending out a little link for you guys just to kind of just give us any feedback, and hopefully that you enjoyed it. And please, if you could fill that in, that would be great, so that we can then hopefully try and improve these and make them better and more appropriate for you guys for different topics if you'd like. Kim did mention the place on our website that we're doing it, and we'll be regularly sending out text messages for you guys to sign up, and hopefully recording them, and then you can share them with your family and friends, and hopefully some of them will be able to give you information that you and your family and friends can look on and then hopefully make the right decisions for your own health. Okay.
Great.
Perfect. Kim, thank you very much. I think everyone, we're getting lots of nice comments saying thank you. So thank you once again, and to everyone who attended, thank you very much, and take care and stay safe.
Oddio, io sepso, vedere a fono parone.